An empty chair in exam room 3 at 2 p.m. on a Tuesday is a permanent financial loss. Unlike physical inventory that you can simply put back on the shelf and sell next week, an unbooked time block vanishes the second the clock runs out. The revenue cannot be recovered. Every no-show costs a physician $200 in unrecoverable revenue. With just 2 daily misses, these losses compound across a 5-day schedule. Annually, this trend strips more than $50,000 from a single provider practice. That empty chair points directly to a critical leak in the practice's foundational business model, requiring an operational fix rather than just a frustrated conversation at the front desk. Across the United States healthcare system, patient no-shows account for $150 billion in financial drain every single year. The national average no-show rate currently hovers around 23% across all medical specialties. If your clinic operates near that benchmark, you are losing nearly a quarter of your booking capacity. For behavioral health and psychiatric practices, the cancellation rates run even higher. In those specialties, an empty slot disrupts an ongoing patient care plan exactly when consistency is required. Most clinics attempt to fight this by throwing manual labor at the schedule. Front desk teams enter a staffing spiral, caught in a frantic, repetitive loop of dialing numbers, leaving voicemails, and waiting for callbacks. The math on manual outreach is punishing. Securing 30 to 50 appointments requires 2 to 4 hours of pure phone labor every day. Relying on clinical staff to chase down data creates a double penalty. You are paying high hourly labor costs to try and salvage revenue that is already booked on the calendar. At this point, most practice managers point out that they already use automated SMS tools to send appointment reminders. But this line graph details a conflicting reality. According to 2025 MGMA data, even as basic automation adoption rises, 27% of medical practices actually saw their no-show rates tick upward compared to the prior year. The root cause is a communication gap. More than 52. This timeline visualizes the exact evidence-based cadence: a touchpoint 5 to 7 days out, a reminder at 48 hours, and a final prompt 24 hours prior. Crucially, two-way confirmation requires patients to reply, allowing the system to immediately lock the visit or release the slot. Data from Imperial College London and Kaiser Permanente shows this specific text-based intervention reduces no-shows by 38% and actively lowers same-day cancellations. Patients actually want this level of communication. Nearly 67% prefer to coordinate via text message, and 40% state directly that receiving additional reminders would help them show up. The strategy works well. However, implementing a robust two-way system generates a massive influx of immediate patient responses. Your front desk must manage that data the moment it arrives to see any financial benefit. When a patient replies to cancel at the 48-hour mark, human intervention is instantly required to backfill that newly open slot before it expires. This presents a rigid operational dilemma. Do you hire a dedicated front desk employee solely to manage this complex confirmation and backfill workflow? Building that role internally requires accounting for a base salary, health benefits, payroll taxes, physical office equipment, and management overhead. This pie chart outlines the true financial weight of that internal hire. When you combine those slices, the fully loaded annual expense for an in-house reminder specialist reaches approximately $60,800. Solving a $50,000 annual no-show problem by adding $60,000 in payroll traps you in a zero-sum game. The strategic alternative is outsourcing the entire reminder and backfill workflow to a dedicated virtual medical assistant, or VMA, through Staffingly. This matrix shows the precise financial advantage. Compared to $60,800 in-house, a full-time Staffingly VMA costs $21,600 annually, a 55% cost reduction. These professionals do not operate in a disconnected call center. They log directly into your existing electronic health record system, whether you use Epic, Cerner, Athena Health, or dozens of other platforms. They execute the daily operational scope from start to finish. They manage SMS and email campaigns, capture real-time confirmations, and perform live escalation calls for high-value surgical or specialty procedures. Deploying a dedicated VMA transforms an unpredictable, high-overhead staffing headache into a predictable, highly affordable daily operational utility. The Staffingly service pairs those human VMAs with an intelligent, risk-based targeting system. This flowchart illustrates how the AI analyzes a patient's history to predict chronic no-shows. High-risk patients are automatically routed to a higher-frequency escalation path, ensuring they receive the exact prompts they need. When a cancellation does occur, the system immediately cross-references your waitlist. It automatically offers that newly open slot to waiting patients within minutes. To prevent message fatigue, the software auto-suppresses texts for patients who have repeatedly canceled the same appointment type. By integrating predictive AI with human oversight, a practice shifts from defensively reacting to cancellations to proactively capturing lost revenue. Practices deploying Staffingly's combined VMA and AI system routinely achieve 85 to 90% show rates. This chart calculates the return on investment. Because you recover $50 to $100 for every previously missed slot, the system pays for its entire annual cost right at that intersection, in just 2 to 4 weeks. The service is fully HIPAA-compliant, requires no long-term contracts, and is live within 48 hours. If your practice is absorbing more than 5 no-shows a week, accepting the status quo is an active choice to forfeit up to $100,000 in revenue every year. Book a free operational demo and start your 30-day risk-free trial by visiting staffingly.com/demo or calling 800-489-5877.